it's Christina with the Sisyphean Journal. Today's February 15th. I already covered today's criminal abortion death, which coincidentally, like yesterday's criminal abortion death, involved a brand new bride. Nina had only been married for 5 days when Dr. Lucy Hagenow added her to her long and ever-growing list of dead patients. Abortion laws are only as effective as the authorities are willing to enforce them. But let's jump ahead to 2013, the era of safe and legal abortions. 38-year-old Maria, who's referred to as patient A in medical board documents, was an abortion patient at Associates in OBGYN Care, an abortion facility located in a residential condominium complex. You see the picture of that condominium complex on the thumbnail. The medical director, Mansour Pana, had been disciplined by the state 3 times, including in 1988 and 1995, engaging in what the Baltimore Sun referred to as unwanted sexual contact with patients. Again, that's something we see again and again and again. If you're a pervert, what better place to go work than an abortion clinic where the woman's already sedated and in the stirrups when you walk into the room, right? So, according to an inspection conducted by the Maryland Department of Health, Maria was 12 and a half weeks pregnant that day on February 13th of 2013. The abortionist, Dominy, did not obtain proper informed consent from Maria, who spoke neither English nor Spanish. But the name Maria, I'm guessing that maybe if she didn't speak English or Spanish, she might have spoken Portuguese. I'm not sure. But at any rate, Dominy didn't perform a proper preoperative physical examination, and she didn't see to it that Maria was properly monitored while she was undergoing conscious sedation. Dominy later told the inspector that Maria slept through the abortion, after which Dominy just left the room. And I've talked about that before. These abortion clinics, their focus is entirely on the fetus, and once the fetus is dead, they lose interest in the woman. Dr. Dominy just walked out of the room. Just bye. Left her still sedated patient lying on the abortion table. The only person in the room was an unqualified worker who was occupied with filling out paperwork and not in any way actually monitoring Maria. Now, at some point, that worker called for a second worker to come in and help her dress Maria, who was still unconscious, and move her to the recovery area. The second worker's like, she's kind of pale and she's not breathing. Wonder how long it took them to notice. Dominy was notified and returned to the procedure room. Now, you would think, you get told your patient's not breathing, right? You would think you go in, you check for a pulse, you double check, put your ear over their mouth, make sure they're not actually not breathing, check the pulse, start CPR. No, she sat her up and did a sternum rub. That's what you do to check and see the responsiveness of a patient who might be in a coma but is breathing. So, of course, it's totally useless thing to do. Absolutely useless. And is it a surprise that nobody came in and started doing CPR? No, because nobody, including the doctor, was certified in CPR. There was a crash cart in the hallway, but nobody used it, and the defibrillator was broken. Somebody did call 911. Paramedics came, and they were able to get a pulse and transported Maria to a local hospital, but the damage had been done, and she was pronounced dead 2 days later. Maria's death certificate showed that she died from severe pulmonary edema, acute respiratory distress syndrome, and hypoxic brain injury. Nobody knows how long she was left there not breathing before somebody got their thumb from out their butt and noticed that she wasn't breathing. The operating license of the facility was suspended after state inspectors determined that it posed a danger to the public. Do you think? The medical board suspended Dominy's license for working in a facility that endangered patients' lives by allowing unqualified staff to perform ultrasounds, evaluate patients, and administer medications without the doctor first examining the patient and determining if the medication was appropriate. So much for a woman and her doctor. She's usually sedated and in the stirrups before the doctor even walks in the room. Dominy allowed her Maryland license to expire in 2018, though she still shows up if you do searches for her name. The clinic and its affiliated clinics in Cleverly, Frederick, and Silver Spring, Maryland, were all affiliated with American Women's Services, owned by that malevolent phoenix, Dr. Stephen Chase Brigham, who is an entire volume of his own. So again, Once the baby's dead, the abortion clinic loses interest. Supposedly the pro-lifers are focused on the fetus, but we provide follow-up generally until the baby's 2 years old. And if she comes back after the abortion, we'll help her get medical care or emotional support. But, baby's dead. My work here is done. Walk out of the room and leave her with somebody who's sitting there doing paperwork. Good enough for abortion patients.